let's talk about weighted equipment and how we can use weighted equipment to support children with sensory challenges. So what I mean by weighted equipment is weighted blankets, weighted vests, lap pads, neck rolls. There's lots of things on the market now that provide a little bit of weight that you put on the child's body. And the theory behind it is that the weight is kind of like when you give your child a hug or a nice snuggle. That pressure helps calm their nervous system and put them in a better state for learning. Some people find that children can be really wiggly and hyperactive, and when they put the weight on them, they settle down and they're more focused and attentive. So that's the theory of weighted equipment. Now, there hasn't been a lot of research done yet that has shown the true effectiveness of weighted equipment. Most of the effectiveness is just seen by people who have tried it and had success. So just keep that in the back of your mind that it's still worth trying, but you need to closely monitor if you're getting the desired result that you wanted. So if your child is not calming down, is not more focused and attentive, then that strategy might not be what works for your child. And that's okay, you can try something else. But if you do find your child seeks out that pressure and likes that sensation, then by all means try it. Just again, closely monitor if it's working. If that's what you're gonna do, I'm gonna give you a couple of guidelines just to keep in mind. The first one is, if you're using a weighted blanket, you should really only use that if it's supervised. We really want to make sure that the blanket never comes up over the head and covers the face and the breathing. So that's why it really needs to be supervised. Weight should never exceed more than 10% of your child's body weight. So get your child's body weight and then make sure the device you're using does not go over 10% of their body weight. Usually it's a range between 5 to 10% of the body weight. So just make sure you're within those guidelines. And then the last thing is make sure that the weight is always close and snug to the body. We don't want things out on the extremities because we want to protect the spine. So when things are snug, it puts a lot less pressure on our spine and it's a lot more safe for their developing bodies. You really should have a therapist of some sort monitor weighted equipment. We don't want to be putting the spine at risk for developing any curvatures or scoliosis or any kind of muscle injuries to the spine. So again, you can use this equipment. It might be very effective for your child, but just make sure it's being monitored and supervised so that your child remains completely safe.